Do you have a child in public school or daycare? If so, they are prime targets for a virus that goes by a long name and takes a short time to infect. Rod Starnes joins us now with important information for parents on how to prevent this disease from having a major impact on your child's health.
Respiratory syncytial virus. That's a mouthful, so we'll call it RSV. It's also a lungful, especially for little Carmen here. RSV is a major cause for respiratory illness in children. In healthy children, the virus can be treated as you would a common cold. But for patients with immune disease, chronic lung disease, heart disease, or for babies born prematurely like Carmen, RSV can cause severe health problems and even require hospitalization. Carmen's doing much better now, but the first few weeks of her illness were scary days for both mom and baby.
She'd stopped eating completely. She nurses most of the time, and it had gradually slowed down. She was having wheezing with her chest, nasal congestion had gotten worse. She'd stopped nursing.
Carmen was admitted to the hospital where she received IV therapy and oxygen therapy to help avoid dehydration and further breathing problems. Fortunately, most RSV cases aren't as severe as Carmen's.
A healthy, full-term child is probably going to get it within the first 2 years of life because their airways are larger and because they got a fuller complement of their mother's immunity to that disease. Then they're less likely to end up with more severe problems.
In those cases, bed rest and drinking plenty of fluids are what the doctor orders. Of course, babies might be fussy when it comes to drinking, so offering smaller amounts more often should do the trick. But as always, an ounce of prevention is worth a pound of cure. Keep in mind, RSV can easily spread through schools and daycare centers. So if an older child brings it home, try to keep him or her away from an infant. And by all means, be sure to take a hands-on approach to prevention.
Washing your hands. That's probably the most significant thing you can do to help prevent it.
Since RSV produces a number of different symptoms, parental instinct and keeping a close eye on the warning signs both go a long way toward preventing serious illness for at-risk children.
As a mom, the main thing for me was that her personality had changed and she had stopped nursing. Her typical patterns of behavior had changed.
Well, I've got an intelligent mom who's very attuned to her child. If she had waited, 24 hours, I can't tell you what would have happened. The child could have gone into respiratory failure and ended up in the ICU on a ventilator. In this case, fortunately, mom's aware of what's going on, and we had a great outcome.
Today, Carmen is getting a shot of medication and a flu shot in order to maintain that good outcome. A few tears now means everyone can breathe a little easier.
She's doing much better. Everything has subsided except for maybe the coughing a little bit. We've been tested negative now for a week or so she's doing wonderful. Her personality's back. She's a happy little thing now, so that's made Mommy much happier.
For Smart Medicine, I'm Rod Starnes.